Hey, what up, guys? Hope you guys are fine. Uh, up to question on. All right. So this question, the students in the exam hall were asked to describe the innervation of the bladder. Okay. The innervation of the bladder, your knowledge will be tested based on knowledge of the muscles of the bladder. Okay. Stuff like that. This innervation is going to which muscle, and what is the action of the muscle? Okay. Basically, that's innervation of bladder that we are talking about. All right, so now describe the innervation of the bladder. This is just like a diagrammatic representation. But what I want you guys to note here is the detrusor muscle. Okay, my cursor. All right, the detrusor muscle. Okay, the internal urethral sphincter and the external urethral sphincter. Okay, just note this. All right, don't worry. You refer back to this image when you have much more knowledge. Okay. All right. So now we said that the nerve supply to the bladder is by the following. By the sympathetic nerve fibers, and they arise from what L2 of the spinal cord, and that's the hypogastric nerve. They pass through the sympathetic chain and they supply what detrusor muscle and the internal urethral sphincter. All right, so I'd like you to know now you have known the nerve, where they arise from, okay, and where they pass through and the muscles they supply. Now let's talk about the actions of this muscle. We said that they cause what relaxation of the detrusor muscle and the constriction of the internal urethral sphincter. Okay, let me find a better image. Oh, this is the internal urethral sphincter. So when urine is entering through the detrusor muscle, this will what constrict, okay, to hold the urine in the detrusor muscle. Once the urine has not reached, once you don't want to urinate, okay, is when you hold urine back is through the aid of the urethra, okay, the internal urethral sphincter, okay, and it is supplied by what the sympathetic nerves. We originate from the L2 of the spinal cord. They cause relaxation of the detrusor muscle and the constriction of the internal sphincter, internal urethral sphincter. Okay, and this will result in what filling of the urinary bladder, and it is hence called what the nerve of filling. Okay, filling of urinary bladder, hence called the nerve of filling. You see where they originate from the L2, supply the detrusor muscle. I could see they still supply the what the internal urethral sphincter. Okay. Now we say that sympathetic fibers also stimulate blood vessels, and some sensory fibers may be important in the sensation of what fullness. Okay, for you to be able to know that okay you are full and you are willing to let go of the urine now. Okay, that's a work of some sensory fibers. Now let's having spoken about the sympathetic nerve fibers nerve supply. They supply the detrusor and the internal urethral sphincter. This is just for you to know that there's also the parasympathetic nerve fibers, and they arise from all the S2, S3, and S4, okay, of the spinal cord. All right, they supply the detrusor muscle and the external urethral sphincter. Okay, if this is sorry, what's happening? If this is the internal urethral sphincter, the down is the external urethral sphincter, right? Supplies the external urethral sphincter. This results in what bladder emptying, okay? And the external urethral sphincter, since it's parasympathetic, is for relaxation, okay? So when the urine is much, it will relax, okay, so that this urine will pass out, and hence it is called what the nerve of emptying or micturition, okay? This is just another image, just complex for you guys that want to know more. You could pause this image, it's self-explanatory. Okay. Next we say that pelvic nerves also have what sensory fibers which carry impulses from the stretch receptors of the wall of the urinary bladder and urethra to the CNS. Okay, and also somatic nerves. They arise from the S2, S3, S4 of the spinal cord. Okay, but that's a pudendal. The first one is a hypogastric, and they still supply the external sphincter. All this one is just extra knowledge. The block knowledge is what we have to talk about: the sympathetic supply, the parasympathetic supply, and so on. Okay, so these guys, we have come to the end of our tutorial on the innervations of the bladder. Okay, so see you guys in the next tutorial, and bye for now.